Welcome, everybody, and thanks for joining us for today's side events during the 8th Multi-Stakeholder Science, Technology, and Innovation Forum. Today's topic is Open Science to Transform Health and Education Systems. In real life, art and science both are important and necessary to transform health and education systems. But today's discussion, we will be only focusing on science and technology and how best to apply technology in the learning process for all. The objectives of today's discussion will also focus on STI solutions for the least developed countries, lessons learned from the pandemic. The expert speakers will also highlight artificial intelligence and big data management. So let's get started on this side event. Please send us your questions in chat box or feel free to send your questions to the speakers directly. Okay, let me start with the Women's Health and Education Center statement. Okay. Can you see the slides, all of you? Yes, I think you can. Open science is essential to transform health and education systems in both the developed and developing countries. And this will help us to achieve the United Nations 2030 agenda by promoting science that is more accessible, inclusive, and transparent. Open science often furthers the rights of everyone to share in scientific advancements and its benefits. Open science encourages scientists to develop tools and methods for managing data so that as much as possible can be shared as appropriate. Let us set the global standards for open science for all. In the fragmented scientific and policy environment, a global understanding of the meaning, opportunities, and challenges of open science is needed for its fair and equitable operationalization at the individual, institutional, national, regional, and international level. Women's Health and Education Center, its acronym is WHEC's initiatives, recommendations, written statements, and side events provide a national, international framework for open science policy and practice that recognizes disciplinary and regional differences in open science perspectives. Bottom line, education and health transforms the world. This is the abstract. Open science, WHEC with its partners will continue to support country actions and strengthen inclusive digital learning platforms and high quality information worldwide. We are already serving in 227 countries and territories. We take into account academic freedom, gender transformative approaches, and specific challenges of scientists and other open science actors in different countries, and in particular in developing countries, and contributes to reducing the digital, technological, and knowledge divides existing between and within the countries. The investment in STI are vital to achieve all 17 sustainable developmental goals. As I have mentioned to you, we have very talented faculty joined us from all over the world, and the objectives of our discussions are to highlight experiences of various technological solutions in improving the affordability of quality of education and healthcare services for all. The experts and faculty on this panel will also clarify how best to apply technology in the learning process. It is the poor and marginalized in our society and in our world. We have the most to gain from the advances in science and technology, innovation, online learning, and e-health. Sadly, at this point, we are often the groups who benefit from this the least. STI solutions for the least developed countries. Let us not leave anybody behind. Countries should take rapid actions towards broadband internet connectivity to their population. WHEC, with its partners, will continue to support country actions and strengthen inclusive digital learning platforms and high quality information dissemination. WHEC's e-learning, e-health, and e-government initiatives. This initiative was presented during 2022 High-Level Political Forum, HLPF, in collaboration with World Health Organization, titled Improving Global Partnerships for Education and Health. Aim of this initiative is to promote and building norms and standards in the health and education sectors. Why the standards and norms are important? Standards connect us with reliable modes of communication, codes of practice, and frameworks for cooperation. Diverse communities rich in unique skills and means of production find mutual benefit in trade and the larger marketplace it creates. But this only can be achieved through the application of common standards. International standards speak to the diversity of interconnected world, introducing uniformity at the interfaces where we need to be certain that we are all on the same terms. Standards build trust. They are at play in almost every product we consume and every process that readiness them for consumption. A web link has been provided to you. It's right here. Please review it at your convenience. Such applications have the potential to make very valuable contributions to our pursuit of the United Nations Sustainable Development Goals. Link Access Project. LINK is an acronym, means learning, innovating, networking for knowledge. Our initiative is accessible in 227 countries and in 6 official languages of the United Nations. Big data management, privacy, ethics, and protection should be lawful, legitimate, and of fair use. Means taking in account the interest of those individuals whose data is being used. Due diligence for third-party collaborators is essential. Third-party collaborators engaging in data use should act in compliance with relevant laws and regulations, including privacy laws, as well as the highest standards, confidentiality, and moral and ethical conduct. For open data, transparency and accountability, appropriate governance and accountability mechanisms should be established to monitor compliance with relevant laws and regulations, including privacy laws and the highest standards of confidentiality, moral, and ethical conduct with regard to the data use. Research has consistently pointed out that the cost of the computers, other devices, and broadband internet is the key barrier in connecting to the unconnected. Women's Health and Education Centers provides free access to least developed countries who are on United Nations Development Program and free access in health and education sectors. Join our efforts to increase the connectivity. Now, closing the technology gap and the future initiatives in education, big data and artificial intelligence are leading to breakthroughs in how we can treat deadly diseases. But who really benefits from these innovations? How many of us will really benefit from this industrial revolution or ultimately really profit from it? If we are to talk about LDCs, leapfrogging to modern technologies, we will have to take into account hardware as well as the software issues. Although investment in technological infrastructure is a prerequisite, investing in capacity building to adapt to existing technology is just as important. Lagging behind does not need to be an eternal curse for least developed countries. They do not remain tied to outdated, inefficient technologies. A critical first step should be recognized and act on the need to support this group of countries to help them catch up. And some of our initiatives are health promoting schools that we have undertaken with the World Health Organization, programs for youth development. We are working on this with UNESCO, mental health programs to prevent gender and gun violence, and how to handle life's challenges in good mental health. These are the few examples, but they all demonstrate that it is possible for least developed countries to keep up with the latest advances in innovative technologies.
Rita, can you let people in before you finish up? There are people in the waiting room, apparently.
That's all right. Yeah. They will stay. Only the pictures will come here. Achievement.
So, Dr. Luthra, if they're not admitted to the waiting room, they can't access the Zoom. I have people who are texting me who are saying they're not able to see the slides.
Okay. Let me finish at this time.
Okay.
STI for building back better. Achievements of sustainable development goals is a marathon, not a race. But when we are hitting a wall, game-changing innovations can help us power through with unprecedented speed and scale. In the end, here is the vision for the future discussion. Space technology and the implementation of the 2030 agenda. As outer space is becoming more congested and contested, while offering a growing pool of benefits to humanity, utilizing space contributes positively to a range of policy areas, including climate and weather monitoring, access to healthcare and evaluation, and water management, efficiency in transportation and agriculture, peacekeeping, security, and humanitarian assistance. The list of Earth impacting space technologies is nearly endless, and many other valuable contributions are currently in the development or being researched. WHEC's initiatives and new initiatives aim to employ a cross-cutting approach, contributing to the use of special science and technology as invaluable tools to help implement the SDGs. Space is for everyone. We believe since space has far-reaching applications, all countries should be supported in accessing the benefits of space-based technology that facilitates sustainable development. Join the mission. Thank you very much. And there is a little change in our program today. Dr. Roy Kanjapi, who is from speaking,
I think he's also waiting in the room to.
he's waiting. Okay, I'll be admitting. So let's admit. Okay, before Dr. Kanjapi adjusted, there is a little bit change. I will request Dr. Ganesh Mani and Dr. Edith Luhanga, who are from Carnegie Mellon University, and Edith is from Rwanda, Africa, to join and present their projects in the African regions for digital literacy in Africa, an essential step towards combating poverty in that region. Go ahead, and after that, Dr. Ron Kanjapi, we will have your presentation. So Ganesh
Dr.
and Edith,
Luthra,
you start. Yeah.
Dr. Luthra, everyone that I invited to the talk is still waiting in the waiting room, and they're not able to hear or see anything.
Even Abhishek is waiting as well. Can we please let people in first before we?
Yeah, could you let everybody in, please?
अरे मैं अपना नाम कैसे चेंज करूं?
Hi Abhishek, you can mute yourself, please.
Yes. Okay. So Roy and Abhishek is there. Rest of them should be able to.
Dr. Luthra, I am hearing that. Oh, perfect. Thank you.
That they will be all seen. Okay, go ahead. Okay, Ganesh and Edith, go ahead.
Thank you, Dr. Luthra, for this opportunity. Delighted to be presenting to the STI forum. My name is Ganesh Mani. I'm going to be speaking about AI in health and education, and then my colleague Edith Luhanga from CMU Africa will follow up with some interesting things. I'm also involved in a innovation center locally, teach AI and emerging economies, rebranded from AI Grand Challenges, do a little bit of work around AI and K-12. Let me start off with some things that went across my newsfeed this morning. This is Midjourney 5.1, generative AI, very photorealistic images and so on. So on the left here, the prompt was woman walking down a cobbled street into the sunset. I think on the left is Midjourney 5.0, 5.1, almost dramatic improvement. So examples of things that are sort of going on in the generative AI space. Likewise, this was on my Twitter feed this morning. Real quickly, this is age progression from, I think, 5 to 95. So think about how this can be used in education, how it can be used in disease progression, how it can be used to showcase climate change and so on. So those are some interesting things here that we need to be thinking about as we look at this. So some background with respect to health, obviously, maternal mortality, the pane on the left, still have work to do in parts of Asia, especially Africa. There's been some significant life expectancy gains over the last couple of centuries. That's what the right pane is showing. But you can also see there's major differences, haves and the have-nots, right? So 2012, this data is a little dated. Japan, Australia, Spain are in the 80+ range, while there are still countries where life expectancy is 50 plus minus. I know there's been a little dip post-COVID as well, but this sort of sets the stage, if you will, for some of the things we're talking about today. Obviously, again, this should be no surprise. Math proficiency and science proficiency are correlated. This is data from the OECD. So, which also means data is lacking in many parts of the world. So is there alternative data, or are there other things that can proxy for this OECD PISA program for international student assessment? That's a fairly interesting standard. As you can see, some of the darker green areas, Vietnam, Finland, some smaller countries sort of come to mind here. On the right pane, here is the latest issue of New Yorker, which shows you the reciprocity and the tension between human and machine, harkening back to the famous Escher painting. We actually wrote an article in AI magazine where we came up with this mantra of the people, by the people, with machines, for the people, stealing a page from Lincoln, if you will, really talking about the future is going to be multi-human, multi-machine. So how can we progress to some of the challenges that are in front of us? We did a retrospective in that article about what's being accomplished. Accident avoiding cars, self-driving cars were about halfway there. Games like chess, AI sort of solved it. With respect to health, in a nursing home, can 90% of the resident care be performed by robots and smart infrastructure, or their background agents that can help you with benefits and savings and so on? I have a couple of cartoons in this presentation. So this winning the New Yorker cartoon caption contest, it seems tongue-in-cheek, but actually, if done successfully, can showcase a lot of different aspects of AI. Information checker, we're awash in fake media, so that's an important challenge. With respect to education, a colleague of mine had just lectured in my class and talked about mentors for every learner, learning 21st century skills. I think there's a little bit of echo. If folks can mute, it would be good. Thank you. And obviously the newest entrant is ChatGPT, which everybody's been talking about. And there's work to be done with respect to showcasing and using technologies like that towards these goals. With respect to health and AI, there are, I think, three broad areas. The medical devices, so these are all the 130 or so FDA-approved medical devices over the last couple of decades. It sort of breaks it down by modality, as well as whether there are multi-center studies and so on. Need to focus on prospective studies, typically used as a second reader, which is why I have this cartoon on the right-hand side bottom, which says, I'm ready for a second opinion. That's sort of the line talking. You may get a chuckle out of that. Both my wife and I were involved as advisors in this early system, one of the earliest FDA-approved second reader for mammograms. I think that happened mid-late 90s. This is Eric Topol's book. He's a thought leader in AI in medicine. It's a little dated. Resource management and optimization, where the healthcare costs in the US are off the charts, right? Can AI be used to do better resource management and optimization? Top right-hand pane is a recent paper that's been getting a lot of attention, where the chatbot was found to be empathetic as well as of comparable quality to some of the physicians. But really, I make the analogy between, there's a difference between you going to your grandma's house and enjoying a home-cooked meal by her, as opposed to she transmitting the recipe to you, right? So two different things, knowledge transmission versus actual experience with other humans and so on. Privacy is dead, long live fake media, right? This is a recent rework of the famous graphic from Nick Thompson from The Atlantic. On the bottom right is a gentleman who was accused by the facial recognition system, article in the New York Times. This is again very recent, top left. They call it non-invasive brain scans, right? fMRI. but it turns out to be invasive. It can actually start reading your brainwaves to impute what you're thinking about and so on. So these are some of the caveats of the technology. We've also moved from science to machine science, if you will. This is a cover on the left-hand side from a couple of years ago. In the old days, you got on the cover of Science for coming up with a new element or coming up with a new cancer treatment, but this was reinforcement learning, game theory, all bits, if you will. So with respect to innovation, it's a big difference between atoms, bits, and cells. The velocity of innovation is higher in bits. There's open versus closed. I think in the last session here, Edith talked about digital public goods. So digital public goods are a great example of open innovation. So can you take digital public goods and then put in private data? Can you put in personalized data in the healthcare field and so on to get to this sort of hybrid innovation? Science of science, that's sci-fi, that's an emerging field. How do you actually compute what's going on in science? What's sort of the network effect in science? So actually, when I was a grad student, there was a professor at Princeton, Stephen Harnard. He started this scholarly skywriting. So I actually came up with the term mega journal, which is now attributed to me. We wrote up something around the COVID tsunami of information, called it, some folks had called it the infodemic, and we said, what are some speed bumps and guardrails you can come up with to make sure information's vetted better? So this is some recommendation with respect to providing metadata, taking the new research, and in a pyramidal mega journal concept, can you attach it initially to the base of the pyramid? And as it gets vetted by more studies, larger cohorts, it maybe moves up the pyramid and so on. So those were some ideas that were talked about. But the Science of Science in the journal Science from a few years ago is a very interesting paper. I recommend folks take a look at that. That sort of started this sci-fi movement. AI and UN SDGs. It's not a panacea, right? If you look at large language models, there's a lot of bias with respect to low resource settings in, say, Africa or Asia, or even out west, because a lot of the conclusions are based on existing writings, existing literature. If those are biased, your conclusions are going to be biased, and then they are energy hogs. So it's very nuanced, the effect of AI on UN SDGs. It's not all positive. This is a paper by Ricardo Venerosa in Nature from a couple of years ago. With respect to emerging economies, focus should be on data and domain knowledge. They need to be regionalized. So data science, any AI project is a triad: data, domain knowledge, and tools. Tools are more widely available, but you've got to pay attention to the innovation data and domain knowledge. I use the metaphor AI is fire. So good and bad aspects. How do you take open science, and what's the role of the UN, right? So that we have less trust and access issues, and some of the things the UN can do or promote collaboration amongst different nations, different stakeholders, also come up with consensus, nudge some best practices and so on. So let me end there. I know we have a lot of speakers today. Let me hand the microphone over to Edith.
Thank you, Ganesh. Let me just share my slides. So I hope my slides are now visible to everyone.
Yes.
Yes, so as introduced, I'm Edith Luhanga. I'm an assistant research professor at Carnegie Mellon University's Africa branch, which is in Kigali, Rwanda. But I worked as faculty also in Tanzania, which is my home country. And my research area is on digital health, and specifically how you use digital health technologies to support behavior change, health behavior change. And what's exciting right now is we're talking about the 4.0s, Industry 4.0, Agriculture 4.0. We're also talking about the same in the healthcare domain. And what differentiates healthcare 4.0 from the previous versions of healthcare is that now the patient is no longer somebody who just comes in and gets a medical assessment and a treatment plan. They are people who bring in data as well. So the vision is, with all these smart devices that we have, the patient is also generating data. With AI and other data analytics, we're coming up with predictions, we're coming up with individualized treatment plans, and the patient is at the center of making decisions with the healthcare providers. So they're no longer an isolated part, they're a key component of making healthcare decisions. It's an exciting vision. It could have great impact because we know that genetics and environment play a part in how well people respond to different treatment plans. The sticking point is, are people ready to use these kinds of technologies? Are they digitally literate? Now, usually we talk about digital literacy in terms of whether people are able to use digital technologies to find first the information they need, but also to evaluate, create, communicate, and even use the information they get. And digital literacy can be hard skills like programming and the ability to create these health systems that we're talking about. But something that's of interest to me is the soft skills. So is the general population able to use the digital technologies to find, evaluate, create, communicate, and use the information around health so that they can make better informed decisions, and they can also be an equal partner with the healthcare providers in making the decisions. Now, we know from different studies that digital literacy increases when people have access to digital technologies, and this makes sense because the more you interact with the technology, the more used you get to the technology, and the better you are able to use that technology. So access to the mobile phones, access to the internet greatly improves digital literacy. But we also know that you cannot really access and use these technologies well unless you have good literacy and numeracy skills. You need to be able to read what's being presented to you and to understand what's being presented to you and make decisions, and these decisions lead you to the next interface and so on. You also need to be able to understand numerical data so that you're better able to understand, let's say, medication dosages and all that. But more recently, we're also talking about digital content itself. So it's not just about what people have access to and what skills they come in with from school. We're also looking at how the technology itself can be designed in a way so that the gap between the information and people's ability to use that information is bridged. And in the past couple of years, I've been working on studies around pregnancy, self-care, and child sexual abuse prevention. And I'll use these two studies to highlight some of the ways the design of a digital technology can make it harder for people to understand and use information, and some of the solutions we tried, and some of the areas where open science can really be beneficial to similar studies. So I'll start with pregnancy self-care. Both studies that I'm going to talk about were done in Tanzania. Now, Tanzania has still very high maternal mortality rates, but what's interesting with Tanzania is that a lot of these deaths actually happen for women who are married or cohabiting with a partner, and also for women who live in urban areas or areas that are rural but very deprived. And it's counterintuitive. You think that urban areas would be more developed, but we have high mortality rates. So the key reasons that the mortality rates are there from the studies that we've seen is that there's a delay in seeking care. And for the trigger for us with this research was that this delay in seeking care is probably related to low health literacy. So we really wanted to understand, with all the information that's available on the internet and initiatives that the government of Tanzania was really pushing forward with apps and SMS-based interventions to improve maternal health literacy, we wanted to understand how often and how well do the women use these different resources for self-care, but also how does the use of these resources impact how they engage in decision-making with health workers. So we ran some surveys and interviews, observation studies to really look at how women are choosing the online information to use and how they're navigating that information. So what do they click first? Where do they go next? What search terms are they using? And we found that, at least for the smartphone owners, not everybody involved in the study had a smartphone, but for everyone who had a smartphone, they were well versed in the different types of online resources they could use. So they knew the Tanzanian versions, but they also knew the baby centers and the WebMDs and all these other resources available online. And they were very excited about having these kinds of resources. But here are some of the challenges we observed. First, the information in a lot of these resources tends to be text heavy. And for most Tanzanians, pretty much all Tanzanians, English is a foreign language. So they tend to be text heavy in English. And even though they're able to, at least with the higher educated women from secondary school up to university, they were able to understand the language, it doesn't always mean they were able to understand it to a point where they felt comfortable using that knowledge. So there are things like figures of expression that are unfamiliar and make the information a bit more confusing. There's also the fact that the information, especially when, sorry, I think somebody's speaking. Okay, I hope you can hear me now. Okay, so the information that's presented, the most comprehensive information they could find was information from, yeah, sorry, I think somebody's unmuted.
Go ahead, Edith.
Thank you. Yeah, so a lot of the information that was comprehensive was not information that's coming from Tanzania. It was information that's available on the US-based websites. But a lot of some of this information is not always relevant to the women. And then important topics, things like malaria in Tanzania and in pregnancy, were missing. And when they did try to search for this particular information, they weren't exactly sure what terminologies to use, because spoken regular everyday English is different from some of the medical English that's there. And finally, when you finally track down this information and you go with it to your doctor, the women were reporting, who do you trust if your doctor says something that's different from what you found on Google? Do you trust Google because it curates information from a lot of sources? Or do you trust your doctor who is more familiar with your context? And so these are some of the challenges that the design of a digital resource might bring when it comes to literacy and the ability, especially, to use information for decision-making. So our solution was, we came up with an expert system, which is basically an AI solution. So as you can see on the screenshots here, women could input some of the symptoms they were facing, and it would come up with some form of prediction, like this sounds like malaria symptoms, and you could click for more information. And with the more information, it would give you something like, you might want to consult your doctor on this. Now, you might see that we had to do some compromises, one of which is we had to do all of this in English. We couldn't do it in Kiswahili, despite the fact that our survey results showed women had a hard time navigating some of the medical English language. And so these are some of the areas where open science would really be beneficial. We opted for English mostly because we found there were very limited medical, easily accessible medical texts or medical dictionaries we could use to train the AI model from Africa. Most of them were closed, and I was at a technology university. So most of these journals that we needed would be in the medical journals that our university didn't subscribe to. So there was that gap of what we could source. And there were almost no texts in native languages. They were all in English. And because there's very few translators out there that can really do English to Swahili translation well, we weren't really able to train the model in Kiswahili. So these are some of the opportunities that exist that we are also working on, trying to create some of these resources. But something else we noticed is that there were almost no design patterns for user interfaces that we could use when you're building these kinds of systems. So depending on how you create your user interface, people might be more capable of performing certain tasks. And if the user interface is poor, it's harder for them to perform a task. But there were no empirically tested guidance to say these are the kinds of user interfaces you really want for AI-based solutions. The second study that we ran was on preventing child sexual abuse, and the literature shows over and over again that knowledge is key, information is key, parents talking to children is key. But what we also knew is that it's a taboo topic in Africa. Anything around sex and sexual abuse with children is a taboo topic. So we really wanted to know what were parents' perspectives on what would be useful and acceptable for them as resources they can use to teach their children, but also what would be engaging and effective as a teaching tool for children on sexual abuse prevention. And we ran a participatory design study, and just to show you the scope of this, we had 111 parents, 24 people working with children, from social workers to pediatricians. We ran this in 3 regions in Tanzania, and these are actual sketches that came up from the parents themselves. And what was interesting to us is that they had managed to come up with the topics that need to be shared, but also the storylines, the characters. And so we ended up developing a game that we tested with children, and it proved to be both engaging and very useful for teaching sexual abuse prevention without ever having to talk explicitly about sex and what it is. And this was an eye-opening moment for us on the need for more studies on the sociological lens on health beliefs and digital health intervention needs, because it's very often you think of the technology first and the users later, but through these studies we've found that sometimes it's just the way the content is designed that makes it easier for people to use and easier for people to understand and accept. But again, something we found was missing was the design patterns. So very few of the digital health interventions studies that we came across that used AI or gamification for Africa had empirically tested how the user interface affects that. And so for future work, and especially with open science, my hopes are that we will have more studies publicly available so we can train more AI models, but also that people who are working on user interface design, on AI, on gamification, once they empirically test these designs, could make them more publicly available so that other developers and other researchers know what are the best practices to use in future technologies. So that's the end of my presentation. Thank you.
Well, thank you, Ganesh, and thank you, Edith. Please stick to your time allotted, because we have a lot of speakers. Now, I think we lost Dr. Roy from Karela. So let me give the floor to Dr. Roger Worthington. He's from London, UK, and Dr. Colleen Kraft. He is basically from California, USA, but I think she's enjoying her vacation in Rome. Okay, they'll address ethical considerations, STEM education for girls and technology training for migrants, and highlight to the case studies in Africa. Go ahead, Roger and Colleen, go ahead.
Thank you very much, Rita. Let me just share my screen just go onto full screen. Just give me a second. Just
I think if you go to view, yeah, on the top.
The bar is hidden. I can't get access to tools because it's behind the screen share. Oh, no, it's okay.
It's
sorry, I was
that
waiting for that to clear. Thank you.
Okay,
now,
you got it. You got it.
Okay, so I'm going to focus on some of the ethical considerations, and Ganesh and Edith have given such a wonderful background on some of the technological issues, and they're far better qualified to talk about that than myself. But as an ethicist, I would like to draw attention to just a few key points. I want to refer all of my content to some specific SDGs. So it's relevant to 3, 4, and 10, which relate to health, education, and reduced inequalities. So that's the benchmark for what I'm going to discuss. So in terms of sustainable development and new technologies, there's enormous potential in relation to both advancing health and promoting equity in education. And we've already had some fabulous examples. Telehealth, for instance, has been much more widely used since the pandemic, and it gives improved access to a number of healthcare interventions. AI, one of the uses of that is for generating plain language summaries so that patients can understand medical texts more readily. And so with remote learning opportunities and the democratization of knowledge, that too can help promote equity. So in terms of the ethics, we just have to be careful, and I think there is quite a little bit of concern being expressed in the public sphere right now about rushing into some of these technologies without stopping to think about the ethical constraints and any sort of moral hazard that might be posed. And I'm not coming up with answers, but I think it's important to ask some key questions, such as who is in control of the technology? What happens if the technology fails or if it's simply not accessible? Who is responsible? Who is actually monitoring the safety and quality of content, if anyone? And the last one is perhaps most significant in terms of the ethics. Is actually who's going to derive the most benefit? Is it really all for the benefit of the service provider or for the end user? In other words, will equity be promoted and improved or not by the use of these technologies? So in terms of some of the potential limitations, I mean, I'll just give some examples. And remote healthcare has wonderful opportunities, but of course, you miss the opportunity for doing a literally physical examination with human contact. And AI, of course, it cannot in itself make moral judgments. It can only refer to judgments made by others in similar situations, and we have to remember that. And as Ganesh has already hinted at, the potential for bias remains because inequalities in the physical world can so easily be replicated and even reinforced in the digital world. So I think we have to be constantly mindful of these things. So in terms of inequalities, just some examples. Global health area that I'm sort of very active in is often criticized for perpetuating colonial era policies and actually making rich countries richer. So anybody working in the field has to be mindful of that. And technology will only change this mindset if the thinking behind the technology itself changes. And that requires reciprocation and shared benefits. And the example I give here is of medical students who often go and do a clinical elective in their final year and often travel extensively to do that. But sometimes their intervention, their short-term intervention, does not really produce a benefit to the local populations, and it can actually cause harm. So in this example, the process has to be a two-way thing in terms of give and take, not just take for the benefit of the student. So as regards the potential for the applied technology, we've already had some fabulous examples. Some of the potential is particularly pointed when we're talking about developing countries. So some healthcare interventions might not be possible without this use of technology. I was attending a UNESCO discussion yesterday about open science and the use of digital learning to help promote that wider access to information and research. And equity within higher education needs to be improved as well. And that means respecting knowledge production from all partners to a research project. And those outputs need to be searchable and acknowledged and rewarded. And this particularly applies to researchers in low middle income countries who are sometimes somewhat excluded. And my last point really is we tend to think that all sort of forms of discrimination are wrong, but actually we teach our children to differentiate between right and wrong. And we need to apply these principles in adult life. So I'm suggesting that it is right to discriminate between actions that promote the public good and those that do not, as we've already heard today about the potential for digital public goods. So public benefit is one of the measures, one of the yardsticks we can use. And the technologies will only benefit poorer societies and people in low middle income countries if these technologies are well designed and, as it is said, if they're accessible and geared towards promoting equitable distribution of wealth and resources. So with that, I will hand over to my friend Colleen.
Thank you so much, Dr. Worthington. And I'm going to drill down on a specific example of an African country that has really focused on science, technology, engineering, and mathematics education, particularly for girls, and that is Ghana. So you'll hear the acronym STEM, and that stands for science, technology, engineering, and mathematics. And let's see, go ahead and go on to the next slide. And this, when we look at our SDGs, we're really focused on 4 and 5. So we're looking at quality education and then also gender equality. Just as we raise the educational level of women anywhere in the world, it helps to promote gender equality. Next slide. So if you look at an evolution towards STEM education for girls in Ghana, the very first thing that needed to happen was addressing cultural and gender bias. That this is something that all people should learn, and girls should have an interest in it, and girls can do this. I'm going to go through that. I'm going to go through how did the STEM programs get started in Ghana and how Ghana has led that STEM revolution. And then finally finish up with investments that are needed to build capacity in Ghana and all over the world, really, even in places where we have more women who are involved in STEM education. Next slide. So the very first thing that needs to be done in any area is addressing cultural and gender bias. And honestly, this happens all over the world, including the United States, my country. But if you look at developing nations, gender inequality manifests through education. And it's really very true. If you don't take into consideration some of the inequality that's addressed in the home, in the culture, then that really has to be the first step of the ladder before we actually have equitable education for all people. Scientific fields are male dominated, and that includes Ghana. So girls' perception has been that these topics are not for them. And this was also true in the United States. I remember when I went to medical school back in the early 1980s, only 20% of my class was women, and now we're over 50%. So girls' perception that these topics are not for them is something that has to change. Unequal gender education has been a function of gender stereotypes and early childhood environment and family expectations. And then one aspect that really is very important in developing countries is the concern of safety and modesty after onset of puberty for girls, particularly if they are in a minority in a male and female together STEM class. Next slide. So what Ghana did was they actually focused on a more rural area of the country, which was Volta. So in December of 2016, UNESCO Accra, in collaboration with the Girls Education of Ghana Service, organized the first STEM clinic in the Jasikian district of the Volta region, which was amongst the lowest performing districts for girls' participation in STEM. And at the time, there were 29 girls who were doing STEM education out of 855 girls in the 3 senior high schools of this district. And so the political will to get this education to girls and to get girls involved in wanting to and understanding this was something that became a goal from Ghana. Next slide. How did they do that? So they started back to the primary education with more of a focus on science and math in universal basic education, which is between the ages of 4 and 15. Ghana is very unique that since 1997, they have a national girls unit. So they've got a countrywide promotion on educating girls, which is really very important because they recognize some of the inequity between male and female education in general, but specifically with sciences. So there was focused preparation of girls to pass the first test, the basic education certificate exam, so they could have access to high school and higher level STEM education. And then they did something very interesting and very unique. Rather than saying, okay, you're in high school, you're in higher secondary school, why don't you take these math courses? They had those available, but they started with clubs because you have to start with interest and you have to build your skills around interest. So they started with an information and communications technology, something that most people don't really know if they don't know that you need to have the science and technology education for information technology, for communication technology. They had international satellite technology education. They had STEM clinics during secondary school to promote that interest and build skills. So again, it starts off as something that's kind of cool and interesting. And wouldn't you like to get into this field that involves engineering? It involves information technology. It involves things that you might never have thought you could do. And to do this, you're going to have a strong science education. You're going to have some physics and math to do the engineering piece of it. And let's help build those skills around your interest. Finally, there was mentorship and teacher training, both that are very, very important, because if you are looking to do science and you're not from a family where anyone has done this, you need a mentor and you need a qualified teacher. Next slide. So finally, going into some of the future investments that are needed to move beyond where Ghana even is at this point. One of them is qualified science teachers. And what we find in Ghana, as well as many other places in the world, is that there are qualified teachers in the urban areas, not so much in the rural districts, and that there needs to be that uptick of teacher education training. Science labs need to be available in schools. Right now, the secondary schools, even in Ghana, only 10% of them actually have science laboratories. Science laboratories are so important because that's where you begin to experiment, and that's where you begin to take those concepts and build some new concepts from them. And it's part of what makes science fun. So really important to have there. Computer and simulation equipment needed in schools, really very much for the same reason, is that you can learn the theory, but really the hands-on work is something that gets the interest of everybody in science. Right now, universities continue to teach the science, technology, education, math subjects, but they use very outdated equipment, and laboratories for research are ill-equipped. Again, speaking to the computer simulation equipment, to some of what is needed for the hands-on piece of this. Mentors for education to career development. Again, there is a gap between what people learn and how they can apply that and how they can find a job in that career. And then finally, co-located healthcare management and hygiene management, which is still a basic barrier for girls not moving forward in secondary school and in university. And so all of these need to be addressed in order to take that STEM education and make it available and make it effective worldwide. Thank you.
Well, thank you, Colleen. It was very informative, and looks like we have lost Dr. Kanjapi again. But anyway, don't worry. I have recorded his speech on WASH projects in Kerala, India, which is water and sanitation in the schools. And I have the link. I will insert the link in the final YouTube video of this program. So Upasana, go ahead. Ms. Upasana Chauhan, who is the main representative of this NGO at the United Nations headquarters, New York, she's expressing her views with the youth leader, Mr. Abhishek Mani, who's working in the rural, remote areas of India and at the grassroots levels with UNICEF, and making life and children and girls' lives better. So go ahead, Upasana and Abhishek, both of you. Go ahead.
Yeah, thanks for the introduction. Hi, everybody. Thank you so much for joining from different time zones and places with us. I would like to introduce and give the floor to Abhishek. He is an amazing youth climate champion, an activist from India. He's currently working on a lot of projects with UNICEF India, with indigenous youth there as well. He has a lot of great projects working with youth in India, especially around WASH and sanitation. And he was here in the water conference as well last month, and I would like to see him in person as well back again in future. Abhishek, I hope you are still on call. Unfortunately, it's a cyclone and raining in Orissa in India as well. So we do have some internet issues. So I think he can turn on his audio. I'm not sure about the video. Hi, Abhishek, can you hear us?
Hello, Upasana.
Hi,
Yeah.
thank you so much for joining.
Hello, everyone.
We can see you.
Okay. Can I turn off my video because we are facing lots of network problem here.
Yeah, don't
We
worry.
are
We just need your
facing
audio
side.
as long as I know the data problem is there. So audio is fine. Thanks.
Okay. Hello everyone. Greetings from UNICEF Odisha. And first I want to give my introduction. I am Abhishek Madi, currently working as a media communication and international relation officer in UNICEF Odisha. UNICEF Odisha. Odisha is a eastern part of India, and Odisha facing climate change, facing heat waves, facing environmental crisis day by day, and we are aware that youth is a backbone of country, and without youth we are nothing. We are nothing, do anything. So we are running a program on WAS. The name of this program is Youth for Water Plus. We are adding plus because we are not working for only water. We are working for water, sanitation and hygiene, climate change, environment and everything to make the India, to make the Odisha uh, better. So let me talk about our innovation challenge for only indigenous people. We are running innovation challenge in indigenous area. We are promoting the traditional method of indigenous people. So, water scarcity and climate change are perhaps the biggest challenge the world has today. Our only hope lies in innovating the final sustainable lifestyle alternatives that each one can easily adopt. It is in the context that Youth for Water announced the Youth Innovation Award. Youth from across Odisha, especially from indigenous community, from remote area. Where is the? I will tell you about the remote area of Odisha. There are many of remote area in Odisha where we didn't find network in our mobile phone. So let's think about those area. In 21st century, we didn't find network mobile in that place, and the people are not aware about mobile and science and technology and even all those things. So here we would try to make them aware about science, technology, and innovation. So we are running a Youth Innovation Award. Youth from across Odisha we were invited to participate with their innovations for water conservation, WAS, and climate resilience. Not only would they get a platform to show their ideas, they would also benefit from the mentorship offered at the various stage of the program and the possibilities of business support in the future. A series of orientation, training, and mentorship sessions were organized for it. So, uh, 230 valid entries were accepted, of which 45 were placed before a jury of experts for evaluation. After 2 rounds of further shortlisting, using an evaluation developed by jury itself, 11 youth indigenous. Even we are also focused on the gender equality. We are maintaining the equality of girls and boys. We are not focused on only boys. We are not focused. Uh, we are maintaining the gender equality in our innovation challenge and in our any campaign. So 230 valid entries from accepted from Odisha, 45 were placed before a jury of expert for evaluation. After 2 rounds of further shortlisting using an evaluation developed by jury itself, 11 youth were selected for the Youth for Water Innovation Award. The 11 awardees were felicitated with certificates and cash prize by our IAS Additional Chief Secretary for the water resource department. So I want to tell about indigenous people innovation. So let me first start from a girl from a remote area, and her name is Rosalind Reddy, and she's belong from Khurda. She's making she's awardee of field tested category. Her innovation is fabric recycling. So her idea is to make the cycle the sustainable and reuse the discharged fabric, and She has a skill in using old saris, discarded cloth, mats, and paper to make beautiful home decor product. So, and I want to talk about another one, Mr. Yash Sharma. He's also
Abhishek, do you
belonging.
have slides? We don't see your slides.
Currently, I haven't because I'm stuck in my office and my slide in my
Yes, he does.
another
He doesn't
PC
have,
in my
yeah,
home.
because of the network issues and because he's stuck in the cyclone, Dr. Ganesh, I'm sorry.
No, that's okay. I just wanted to make
But
sure.
he will share the presentations
I
later.
will I will
for the
share I
reference.
will share after this session when I will share with Upasana ma'am. So I want to tell about Yash Sharma. He's also belonging from a indigenous community called Santhal. Santhal is indigenous community of India, and Yash is pursuing Bachelor of Art in Sociology from University of Odisha from last 2 years. He and his team has been working in various public service activities, started from plantation drive, blogging, cleanliness drive, and so on. So his innovation is plastic pyrolysis. Mainly, I want to tell about plastic pyrolysis. So his innovation of plastic pyrolysis will solve the nation's problem. This is on green technology. It reduces the single-use plastics and make fuel and biogas and char for road bricks, making raw materials and easily available for some slum areas may get engaged. The main solution is that they can easily reduce the single use of plastic as well as the reuse plastic. In pyrolysis, 450-degree Celsius temperature is required, but their technology can extract the same product as 270 to 350-degree Celsius. It provides 650 ml of diesel out of 1 kg plastic. His future plan include creation of robust structure and plastic pyrolysis. So these are our stars. Innovate. These are our star champion from our youth innovation challenge. So personally, I am facing some network issues.
No problem. Abhishek, I think we are also running out of time, but thank you so much for sharing about the projects of amazing young people who might not even have access to the fancy technologies we are discussing on the other side of the world, but they're doing amazing projects, recycling the materials available with them and becoming part of a better future. Dr. Rita, I know we are running out of time and it's 9:37. I'm not sure who's up next.
Sarina. Okay, let me give the Sarina, and if there is any time left, you can
Yes.
condense the summary of Abhishek's work. Okay,
Yes,
go ahead,
we'll
Sarina.
share Abhishek's presentation and videos later for everybody reference as well. He's really stuck in the middle of cyclone right now, so unfortunately, I'm sorry for that.
Sarina Manny, who has just finished Masters in the Public Health from Johns Hopkins, will address mobile health, especially its application in adolescent health. So go ahead, Sarina.
Hi, everyone. Let me get my slides up. Is everybody able to see these?
Yes.
Okay, wonderful. Thank you for confirming. So, hi everyone, my name is Serena. I am a current Master of Public Health candidate at the Johns Hopkins Bloomberg School of Public Health. And I'm here today to talk about adolescent voices and the development of effective mobile health tools. And so to start off, I wanted to talk a little bit about the Armadillo study, which was a mobile health intervention for sexual and reproductive health. And this particular study was conducted in Kenya. And the authors of this study identified that over 33 million women and young girls ages 15 to 24 in the developing world have an unmet need for contraception, and Kenya is no exception. And so they developed this mobile health intervention and conducted a randomized control trial on it. And this application was essentially a cell phone where it was this application where people could text in their questions regarding mobile health, and the application would give an answer. And so it was a pretty straightforward way for young women and girls in the country country to get information regarding sexual and reproductive health. However, despite the study being very collaborative, they had done focus groups, they had worked with not only youth, but also their families to develop this, there were some issues regarding non-engagement of participants. And so one of the key issues that they highlighted was that when youth would provide a phone number, it wasn't always a phone that they owned, it might just have been a phone that they had access to. And so when we think of mobile phone ownership versus mobile phone access, especially when we're dealing with topics that might be stigmatized, such as sexual and reproductive health, it's very important that adolescents have a good relationship and a trusted relationship with the person who the phone belongs to. And so that could be a brother, it could be a parent, but thinking about these topics in that sense of how do we also break down barriers around stigma so that these interventions are the most effective. And so this brings me to a study that was conducted in Canada regarding help-seeking behaviors amongst youth and some of the barriers to those to youth seeking help. And so this particular youth highlighted that in schools, there was stigma surrounding mental health and that they had encountered guidance counselors who hadn't understood the struggles that they were going through. This other youth brought up that a lot of doctors do not know how to talk to trans patients, and that can lead to a lot of stigma. And so thinking about how these mobile applications can help bridge the gap between what providers might not be comfortable addressing, they might not have the context to appropriately address it to the youth's needs. But just thinking about how do we start to bridge that gap, how do we break down that stigma and have the most effective interventions that are also partnered with educators, with providers, and with youth. And so I wanted to talk about just this concept of protecting adolescents. So protecting the right to education, promoting mental well-being in schools. How can we provide agency around contraception, around childbirth to lead to better outcomes? And how can we allow adolescents to advocate for themselves? And so this brings me to another quote regarding stigma and in a sort of development perspective. And so this youth said, well, put on a good show and maybe we'll help you if we have the space, if we have the funding, or if we have the room. And it's really humiliating. And so for a lot of who might not feel comfortable approaching these spaces, so they might feel like this other youth identified that it was humiliating to have to sort of explain what was going on with them in order to get the care that they needed. These mobile health tools can be a very, robust way of seeking care where they, might not have to go into a clinic or they might not have access to a clinic. So there are a lot of benefits to it. But it also has been observed that digital mental health technologies can increase the risk of stigma for young adults and children, especially when we think about relevant data being exposed. And so one way that we can reduce this harm is to mediate this with a provider and trusted adult. And so thinking about what youth want to use mobile health devices for, we think of applications with a lot of bells and whistles, but they have very simple use cases. And so they're interested in information gathering and social support and inspiration and tracking behaviors and health goals. And so, how can we really start to mediate all of the things that youth want to use these mobile devices for, but how can we also think about, reducing stigma, about potentially having them partner with providers, with trusted adults. And like I mentioned in the armadillo study, when you do have issues surrounding non-engagement, how can we get youth engaged with these tools in a way that's stigma-free? And so that brings me to what can you do today? And so thinking about just communicating with the adolescents in your life, helping them to cultivate their digital worlds. And so sometimes adolescents might have very different digital worlds than they do, have physical worlds, and just understanding that both of those spaces might feel different to them, but that it's all right to engage with providers, with adults, with educators in that digital world, and that we can start to break down the stigma not only in our physical worlds, but also in our digital worlds. And then letting adolescents into spaces as moral equals. And that brings me to what we can do tomorrow. So advocating for youth voices in mobile health development, which they did a wonderful job with that in the armadillo study, despite some of the issues that they had run into. And then training providers to center youth as experts of their own experiences. And so providers can also rely on these technologies to help them reduce stigma and to help them, start to mediate these relationships. And so they can communicate to adolescents via these devices. There are ways that they could be prompted as well well. And so thinking about, how do we best reduce harm, but also make sure we're reaching the relevant populations. And then, like I mentioned, consider mediating the digital solution adolescent pathway with a trained provider and a trusted adult. So once again, just thinking about that partnership. So youth aren't being asked to use these interventions in isolation. And I think that can really increase uptick of these interventions. And so thank you for your time. If there are any questions, feel free to drop them in the chat, and I will hand the reins back over to Rita.
Okay, very good job, Sarina. And thank you very much. We had a lot of discussion. Here is the link for the Youth for Water campaign by UNICEF India, led by Abhishek team, but I don't see the link, or it is there somewhere. Oh, no, link is up.
Link above that, yes.
Link is above that. Okay. So, and Dr. Roy Kunjapi, of course, we couldn't get the connection, but we had pre-recorded his work in Kerala, safe, really health promoting schools in Kerala. And you can get that YouTube video via this link. Well, thank you very much. And we have completed and or finished our time allotted. And it was a nice discussion. You can contact these speakers directly if you have any questions. Anybody has a last minute comment? Roger, Colleen, Ganesh, anybody? Edith? No. Okay, so Science for All. Thank you very much for joining.